record.
I know. I was like, I
can
see it. I was like, I'm invested.
Can you see us?
I can see your picture. Oh, now I think it's getting ready to that photo that you said your dad's had a comment on.
Oh, right there's the top, that little red dot. You toggle it back. I had this happen on mine and I didn't know it. There you go.
Can you see us now?
I can see you.
Hey, hello. Yay, hi, yesterday was so fun. Hey, we were just talking about spiritual, God showing up through us and just like
Thank
we're talking
you.
about. We had that to never give that up. I'm Diane Finisted Ellis, and this is Pam Berry, and this is the one, the only Kathy Conley Jones, and the one, the only Courtney Hudson. So we are day 2. We are getting into it, folks. So yesterday, just to recap, we went through the 2 sides of Medicare, both the supplemental side and the Advantage side. We used this beautiful sheet, which is page 10 of your Medicare and You book. And then we said, okay, there's a 65-year-old woman who calls you and she says, my husband is 60 and I'm leaving my group insurance. So now what do I do next? Look at Kathy. She's getting out her green folder. So you too can have a green folder going forward. So we have this wonderful worksheet, and this is the Medicare worksheet that we work through. And the big thing is you got to find out, are they going to do the group plan? Are they going to do the supplemental plan? Are they going to do the Medicare Advantage plan? And then you fold this side, cover up this other side, with a blank piece of paper. And then you make those decisions here and this and this. Look at Kathy, she's showing everything. Yay. And then she's going to show this Medicare sheet. Woohoo! Yeah. There it is. And then the second section we went through was the hospital indemnity. Oh, look at Kathy. She's so good. And then we talked at length about the home health care, the short-term home health care. And then we also talked at length about the cancer plans, particularly the precision cancer plan through GTL that will test the 19,000 genomes so that you know genetically what type and what amount of radiation and chemo that you should have for your body. Or you could just have a lump sum pay you like an Aetna plan or a Cigna plan for cancer, or there are other cancer plans that just have it partitioned out for each different type of service that they would pay you. So the amazing thing is that is this worksheet right here. So we talked a little bit about going into the under 65 worksheet, because we've got this 60-year-old husband of our fictitious client so Mr. Fictitious, we said he could look at ancillary on the top of that sheet. So it's one where it says under 65 chart, and at the top, now I will say that anytime you give these sheets to your clients, you need to write big and bold across them, disclaimer, because you don't want your clients to ever get this sheet and said, well, you got this for me. No. We talked about it. And then on the date up here, you can put the date of the appointment and was it a call, was it a Zoom, or was it in person? So you can have that for your records, but you always, on any of these sheets, you want to write disclaimer. Okay. And then you can put your disclaimer on there. My personal disclaimer that's been approved by my lawyers, and then also for the 2 teams that I work with on the over and the under, is this is a worksheet. This is a work in progress. This is not a final decision. And so again, this is a worksheet. This is a work in progress. This is not a final decision. The original conversation is dated above. And that's where, and so you can also put on here where the next conversation is, or that you're continuing that conversation as we talked about yesterday with this Medicare worksheet, because they might be overwhelmed after you've chosen which side they want to be on for Medicare, or if they want the group plan. And then you've talked about covering it with the hospital indemnity for the hospital as well as the rehab, probably the outpatient surgery, probably the ambulance rides, and probably the physical therapy, occupational therapy, and some chiropractic. So when you have that conversation, some people's eyes glaze over. And so you need to write on that page, we will meet at such and such time, such and such date, and go ahead and set the next appointment to continue on the conversation with home care and cancer, letting them know we haven't covered everything, but maybe their eyes have glazed over and they just don't have the capacity, or maybe we don't have the capacity at that point.
Right.
This can go on.
Go either way.
So anyway, okay, so now you know about the disclaimer. So let's get back to where we ended yesterday. And we got into this wonderful conversation about ancillary products on the under 65 worksheet. And you can see here, the first one says an accident plan. When you are working with the accident plans, the two companies that I have enjoyed working with for accident have been UH1 and Allstate National General. So when you're doing quotes on there, you will come up with a bundle of products that you could put in there all at the same time. Sometimes that's easier than partitioning it out to other companies, but to partition it out to other companies with the other products, you can sometimes save your clients money. So it's just dependent upon, what you want to do. But to give you an idea, last night I was working with a client and he happens to be 50, his wife happens to be 49, their son happens to be 11. We were looking at a National General plan that was here in the St. Louis area of Missouri. And so prices do change no matter where you are. But it was one where I looked at it and I said, you know what, you could cover that $5,000 deductible that you're looking at for your catastrophic medical plan. And it could cover for accident, and it could pay up to $5,000. He goes, well, how much is that, Di? I said, it's $25.73. It covers all three of you. Would you like to just add that? He goes, a month? And I'm like, yeah. He goes, and it would give me the $5,000. I'm like, yeah. I mean, it's not going to let you go skydiving or anything crazy like that. But if you fall and you break something, and then, yeah, that's an accident. And he goes, have you ever used it? I said, yeah, I have. He goes, are you going to tell me the story? I said, yeah, I will. So I was, oh my gosh. I was just in my robe and I'm in the kitchen, and I was actually slicing through a bagel that didn't come sliced. So I was using the bread knife. Well, so the bread knife got stuck and I pulled it back. And as I pulled it back, it came out of my hand and it went right down in between my big toe and the one that went to market. So, oh my gosh. So spurt. So who do I call? This was years ago. This was before mom had passed and everything. I called my mother. I didn't call 911. I called my mom and I'm like, Mom, there's blood everywhere. Oh my God. What happened? I said, I was trying to cut a bagel. And she goes, are you wearing clothes? And I said, I only have on my underwear. I said, I don't want to call 911. I don't want to go to the emergency room just with my underwear on. And she goes, the first question was, she goes, is it clean underwear? I said it is, because you taught me always wear clean underwear. And she goes, oh my God, call 911 and I'll meet you at the hospital. So I call 911. I get there. Of course, it's all wrapped in a towel, and oh God, it was just a mess. Yeah. And they're like, you didn't get any arteries. It's okay. It's okay. And I tell him, I'm like, well, I was really hesitant from riding in the ambulance because I only had my underwear on. And he goes, you're worried about that? He goes, we've seen everything. He goes, more people have died because of vanity. So that's what I'm telling you, folks. This accident plan, get it. It's affordable. And so I had it, and I did have a $5,000 deductible at that time. So all they needed was just the receipt and everything from the hospital, the UBO4 form, and the stinky form is what I call it. It shows that I was at the hospital. And then I sent that in, and they wanted to see that I had a follow-up appointment with the doctor within a week that said, yes, this was an accident. How could it not be an accident? So, but that's my story. I'm sticking to it. Now it's on tape. We're all laughing about it. Okay. So anyway, we go on. Get the accident plan. Okay. So the other one I'm going to skip over to is over on the left-hand side. And that one, it says in-home care. Watch the video from yesterday. We went over and over and over how important it is to have in-home care. And then for immediate, that you don't have a waiting period for it, it's immediately. And then the other is dental and vision. Okay, so I'm going to do this commercial for dental and vision. If you need to have a dental the next day, don't wait to call someone like Kathy Conley Jones and Pam Berry and myself and Courtney, because we can't guarantee that we're going to get you that coverage that day for the next day. As soon as you know that you have a dentist appointment coming up, oh my gosh, call us. And so what you need to do is tell us from the dentist office, this is the dental code, and this is the description of service. And with that, what we can do is we can look and see which company is going to be able to cover that the best. We need the name of your dentist. We also need their group, and we also need with their location. And then we can look them up. So for example, there are companies that they don't have the 12-month wait, that you can get coverage the next day. For example, in CD, which is MetLife, is one of those companies. Another one is Mutual of Omaha Dental, and they have the Dentamax is one of their networks. They have the two other networks too. And then also Emeritus. So all three of those companies have both in-network and out-of-network coverage. So you could time it. You could say, Diane, how much of that $5,000 policy for $68 in the St. Louis area for Mutual of Omaha, how much of that do I have available to me immediately without a 12-month wait? Typically it's 20%. That's how it works in St. Louis. And so you'd have $1,000 that would be available to you if you had a bill for $5,000. So NCD works like that too. You get 10% upfront if you had a bill for $10,000. So some of them do cover the partials and that type of thing. Some of them don't. So if you need partials, then you got to ask, hey, here's the code. This is what I need. So we make sure you're getting the right plan. Now, people will say to me, now, Di, so PPO means I can go in network or out of network. Great. Yes. If the doctor is in network, typically you're going to save about 30%. Because they're like the Wild West. They can charge whatever they want to charge. And I don't want to offend any dentists that might see this, but if you see a gorgeous dental office, oh my gosh, folks, you're paying for that. Okay. So what you want is someone who went to dental school, they have all the stuff on the wall. You see all of their health grades online. You can tell that they're a good dentist, and they might have old chairs. That's your dentist.
My dentist.
So hopefully you're not paying for new chairs and all of that gorgeousness around you.
They just redid the leather and they're like, you're going to have to sit up yourself. But I love it.
No, we don't want any redone leather. Thank you very much. So the dental stuff, people will ask, Di, can I have more than one dental? Oh my gosh, you could have like 3. So for us in this industry, what really, really works the best for us, because you love us, I know everybody loves their agent. you need to have those policies for 3 months, because after the 3 months, the companies are wise to what we're doing if it's before 3 months that they cancel. So, but if you keep it for 3 months, we're not in trouble. We're not in trouble for getting you that extra dental. And who knows, you might need some more, going into the future. So one of the strategies that I use is, if someone says, Diane, my teeth are great for the under 65, fantastic. Let's find out. And so I'll get them one plan, and that will be like a $1,500 plan. And it usually runs about 38 bucks in the St. Louis area. Go get your teeth cleaned twice a year. You're still going to make money. You're going to save money on this thing by having, your teeth clean and the bite chews and the whole thing. And then if they happen to tell you, oh, you need a crown, you need this, you need that, you're going to come back to me and we're going to add another policy, because we can. There's no 12-month wait that's going to defray the cost. And so, and then after that, you can decide, that person can decide, do I keep the two plans because they're going to save me money, throughout the year, or do I just go down to the one plan? So always carry a dental plan, because $38 doesn't really change anybody's life, but it can save you money. And then if the problems happen, then you let us know, and we can always look and see what we can add. Now, we were talking about the husband of the woman who's 65 and she's got the 60-year-old husband. We need to ask them, is it going to be portable for the dental? Are they going to be able to leave and go and have this portability and keep their dental? So a client of mine the other day, my gosh, they worked for a huge organization, huge company. They have over 6,000 employees. And I said, how much is your dental a month? And she said, it's 27 cents. And I'm like, and how much does it cover? She goes, it only covers $1,000. It's not very good. I go, well, for 27 cents, that's a really great plan.
Yeah.
We're going to keep it. And then we're going to get you another one if you need it. And she said, oh, we can time that? Yes, we can. So, so always, always, always tell your agent what you have, what you're paying, and then as the agent asks what you have, what you're paying, and then what they think they might be having come up in the future, and what their experience has been in the past with dental. Same with vision, but I'll just give you, vision stuff. I'll tell you what, vision with Emeritus VSP and Emeritus IMED, they run about $10.67 with IMED in St. Louis. And you can get glasses every other year, and you get like $150 towards the frames, and then the other stuff is pretty much covered. And then VSP, the difference is it's $16.67 a month in the St. Louis area, and you get glasses every year. So those are kind of my go-tos with that. However, if you are building a plan on the platform of a UH1 catastrophic plan or a National General catastrophic plan, you will see options in there for dental and options in there for vision. I think Kathy might have a question. Kathy, can you come back on?
Yes. Okay, can you hear me?
Yeah.
Okay, I was doing things with my nose, so I didn't think you wanted to see that on camera. So one of the questions that I wanted to ask, and specifically, the young lady who's working for the company, and she's at 27 cents is her premium. One of the things we always wanted to make sure of asking is that 27 cents, is that particularly your employer contributing so that all you have is 27 cents? What you want to make sure you have them ask is, what is your sort of, I'm gone, the Cobra premium?
Yes.
So that's very important.
That
And
Cobra
I know that you were
because
going
they
to say
think,
that, but I
oh, it's
just
going
thought
to be
I'd
the
jump in.
same.
Absolutely.
Right. Oh my
And
gosh, Kathy,
and
thank you so much.
exactly what, because they sometimes they think it's still 27 cents, but you're gone, your employer was contributing a portion of it. Find out what that number is, and it's always good for them to know you can make basically for your dental, your vision. We're not worried about the medical right now. For the dental and vision, that they have the option for Cobra, which means they can continue that coverage for 18 months. If you've got individuals who have had issues and they're with their teeth, and then we don't want the waiting period. That's why it's so important. It's laddering, right? It's layering and
Yes.
saying you maintain that particular coverage. And before you had that coverage being deducted or that premium being deducted on a pre-tax basis, you won't have it now, but the benefit overrides the pre-tax issue because your dental that you get individually is not deducted on a pre-tax because you're not working. So that's just one other piece.
Yeah.
I think is really great. And of course, I know you were headed that way, but I just felt like I had to say something because I'm a broker and I can't keep my mouth shut. So go right ahead.
No, I want you
Yeah,
to
we
talk.
love
Come on
it.
back and show us, show us your beautiful face. So now that there you are. Yay, yay,
There you go.
Kathy.
Okay,
Yes,
I was doing my nose.
interject. I'm just saying, I'm like a little like that, but
Yeah, I'm getting a little sniffle, so I'm sorry.
It's because it's 80 degrees outside. You
Right,
can't
I
really
know.
touch
I was
the
like, well,
world.
what's going on here?
Probably everything blooming. Yeah.
I have a question. That was sort of a in um in
Interjection.
yeah, interjection. Thank you so much. uh you get older and you can't find the word. It's up there somewhere and you'll pull it down in just a moment. So one of the things I did want to ask is the programs that we have that we're offering are those programs offered as well in a group situation? Can those be offered in a group where the employer can, you have to have 5 or 10 people in the organization and they can have that deducted from their paycheck only because it's a group situation. So I was just asking on that.
Absolutely. Yes. And there's group dental beyond those three that I had mentioned that are immediate. Because most if you leave your employer for dental particularly, and you've had consistent dental for 12 months, you can get a rider that allows you, or is actually you can get permission to go into another program where it won't show that you're in your first year. It'll go into your second year.
Okay.
So that's interesting too. Delta Dental was one that was offering that. I don't know if there still are. Cigna was offering that in the past too. I don't know if they still are. So, but it's worth knowing, like what Kathy was saying, it's so worth knowing where are they and what expense are they expecting and what will the actual cost be when they go onto Cobra. Because a lot of people think, oh, 27 cents, it'll stay that. No, probably not. But if it did, oh my gosh, where can I work? No.
Be nice.
I know, yeah. Yeah,
We miss all those benefits as a broker.
We do.
Yeah.
We are our own broker. That's right. So,
Thanks, Diane.
yeah.
Yeah.
Did you have another question, Kathy?
No,
Okay.
no, I
So
was just
going
saying
on.
thank you for
One of
taking
my
that.
favorite things to talk about. If I am not showing my passion to you about short-term medical home health care, then I'm about to show you my passion for fixed benefit plans that would be for the under 65. Now, they cannot carry these beyond age 65, and oh my gosh, do they wish they could. So let's talk about the fixed benefit plan that I have really loved, and lots of people love it across the country. And it's the Manhattan Life fixed benefit plan. It's called Affordable Choice. So they have 4 different formats for the plan. The classic plan is the one that I personally have sold the most because it overlays with the 3 choices for medical. So again, we're just talking about the ancillary overlay. So that's why the ancillary is on top with this sheet. So you have the overlay of the accident plan, and it can overlay on all three choices for the medical for the under 65, or you have the fixed benefit plan, or you could do both. Lots of people do. And then, or you could do the dental, vision, and hearing and the in-home care as an overlay, or you could do all of those as an overlay. It just depends upon how comprehensive you want your policy to be. Do you want it to be basic, or do you want it to be comprehensive? So the fixed benefit plan merges with any of these. So for example, and we're not talking about this first column here, which is the catastrophic medical. We're not talking about the major medical, either with group or the marketplace, or in a private group. But we're talking about if that person decided to go with a fixed benefit plan, how it merges with that, and if they had a $5,000, let's say, deductible. So as I shared with Kathy yesterday, during COVID, I had a nurse call me from one of the hospitals here in St. Louis, and she said, Diane, I'm going to be transferred to New York during COVID, right in the very first beginning part. And she said, what am I going to do? If I get COVID, I'm going to be out my $5,000 of my deductible. And that was also her max out of pocket, which are two different things, as we all know, and sometimes they're the same. And so she said, I'm out $5,000. I'm really afraid I'm going to get sick, and I'm going to get COVID, and then I'm going to be out that money. And she goes, can you find anything that would cover that if I went to the hospital? So I looked at the hospital plans, like we were looking at yesterday typically it's for the over 65, but you can get hospital plans just for the under 65 too. And I came across this plan. One of my friends in insurance, she said, Diane, have you ever looked at the Manhattan Life Plan? And for the affordable choice, I said, no, what's the deal with it? She goes, well, this is the classic plan alone. What happens is if you have the enhanced plan, she said, they're going to get, if your client goes to the hospital and is admitted, they get $1,000 for being admitted as an inpatient. And so they don't cover observation because it'd be way too easy to get this money. So then if she is inpatient in the hospital, she is going to get $2,000 a day 1 through day 30. And I was like, oh my gosh, that's amazing. And I said, so if she's in there for 3 days, then she's already getting like $7,000. She uses the $7,000 to pay off the $5,000. And then she would have $2,000 left over. So she had some, weird medication she needed to pay for that wasn't on any formulary, or she needed to pay for her extra stay in that area when she was, renting a VRBO with 2 other nurses. And I'm like, oh my gosh, or she could pay her car payment, or she could pay her mortgage back in St. Louis, or whatever. And my friend was like, yeah, Di, that's how this thing works. I'm like, well, does it stop there? And she said, no, this is the classic plan. And she said, the classic plan is really there to partner with another plan that they would already have in place. And I said, well, her plan's going to pay, $2 million once she reaches that 5,000. And she said, that's exactly right. And she said, and she's going to be able to send in her receipts and get the money back. I'm like, what are you talking about? And that's the fixed benefit. So fixed benefit is sold on a life insurance chassis. So when the money comes to you, it's indemnity. And so it came to her. And so she actually was in the hospital for 10 days. So she was able to get back at $2,000 a day. She was able to get back 20,000 right there. and then she got another $1,000. So she got $21,000. She used 5 of it to pay that off. So she had 16,000 in her pocket. But here's the deal. Had she gone to have surgery, she would have gotten 10% up to the cap of 50% in that particular, we're talking the classic plan, not the other plans. And she would have also gotten some money for back for an assistant surgeon. She also, if she would have gone to the emergency room, she would have gotten $500 one time. If she would go to the urgent care, she would get back $250 twice in a year. As she goes to her doctor's visits and her specialist visits, she's getting back $75 up to 6 visits. And if you don't use those, they roll over. And by the way, the next year she has the plan, it's no longer $2,000. It goes up and it goes up and it goes up. And then it eventually caps at around $6,000 a day, the longer you have the plan. So I asked her, do you take any medications? And she said, yes. I said, how many medications do you take? And she said, I take 3. I said, okay. I said, are any of those for mental health? And she said, no, they're all 3 just, standard generic medications. And I said, okay, well, those generic medications, it's worth $25 a day. So if she filled 3 in a day, she's getting $25. If she picked up 3 at 3 different days, then she could get $75 in that month. And she gets back up to $750 for the year. That's the cap. Then if she goes and has I said, are you going to get a mammogram or a pap smear this year? Are you going to get a colonoscopy this year? Are you doing any of that stuff? And she said, yeah, I got to do all of that. And I said, well, you're going to get back $250 for your pap smear. You're going to get back $250 for your mammogram. And then you're also going to get back $500 for your colonoscopy. I said, do you do any lab work? She goes, I do. And I said, well, lab work has a cap, but typically lab work's going to give you back $50. And MRI gives you back money and CT scan gives you back money. And we were just looking at the normal stuff that everyone gets. And I said, you know what? I said, just in a normal year, because this was after the year that she received a lot of money. I said, just in a normal year, when you pay your premiums, you're going to get back like $850. And she goes, well, remind me what my premium is. Oh my goodness. Her premium, because she's 45 years old, her premium's $110 a month. So y'all do the math. It's like $1,200. So she's already gotten all that money back, that first year that she's ever going to put into the plan for like the next 20 years. And if Diane math works.
It's like mine.
But the main thing is she wants to keep that plan because, she's going to get that $850 back probably every year, even with her 3 medications that you're looking at. Because 3 medications, filling it on 3 different days, is going to be $75. You times that by 10 months, that's $750 right there. And then if you just went to the urgent care, that's $250. That's now we're talking $1,000. And she's only paying like $1,000. So this plan is amazing. It's one where when you explain this plan to clients, it's like, oh my gosh, why wouldn't I have this? Exactly. It gets me as excited as the short-term plan that we talked about yesterday, because who wouldn't want to have this coverage? And then you can look at plans that might have a huge deductible. We're looking at entry-level plans, folks, for the marketplace are $7,500. $10,000 like maximum. 10-8, 10-6, 10-8, and they say, oh, you can get an HSA. Well, great, get an HSA with it, because then you can take money off the top of your taxes, and there's a benefit for that. And you can use that money to also pay this. But my gosh, get a fixed benefit plan, because it's going to pay you. Now, that's if you want to go the route of having a fixed benefit cover the gaps with this first column, which is the catastrophic plans. And those are usually 6-month plans, or they call them tri-term plans for 3 years. And what they do is they say you can have a $2,500 deductible, $5,000 deductible. One of them offers $2,500. And then you could do a $7,500 deductible, or you could do 10,000 or 15,000. And then it'll pay to either $1 million or $2 million, depending upon the company. And so what comes with that is you would be able to have to go to the urgent care, you'd pay $50. And then when you go to the doctor, sometimes they're covered, sometimes they're not, depending upon the plan. But you can structure it to where that fixed benefit plan and then also this plan, catastrophic, they pair nicely to each other. But here's the deal. Both of these are medically underwritten. So you gotta be healthy to get the fixed benefit and the catastrophic plan. They will look back the 6 months. They will look back and see your medical history and see if you have any pre-existing conditions. So that is a huge difference. So if you have had cancer, stroke, heart attack, HIV, those are the big 4 that they're going to ask for. But then they're going to drill down when they see your medications. And there's long lists that we all have. Kathy has it, Pam has it, I have it, Courtney has it. And we can say, okay, what medications do you take? And we can do a medication lookup and see if you would be included and be able to go through underwriting, or you would be discluded very quickly. So that kind of separates, can you have this option or can you not have this option? So then if you cannot have that option, then you're looking at either employer-based plan, or you're looking at the marketplace for your plan, because those two cannot ask about your medical history. Okay. So to get the plan. Now they can ask actually, but they're not considering that for underwriting. And I say that particularly because Kathy will correct me, I know, when it comes to group health, they're going to ask about your health history, but you're still going to be able to get into that group health plan. Whereas the marketplace isn't going to ask you about your health history. They're going to ask you a lot of weird questions, but not that one.
That's true.
I mean, those questions are weird.
Yeah.
Good response. That's exactly right. Weird questions, but not that one.
Thank you, Kathy. The voice of reason has spoken, folks. So over here on this side, though, this one I want to talk about, and that is that you have to be healthy to look at group health through an individual basis, where you're lumped into a group health plan, and they also ask health questions. So only the one in the center that says group plans and marketplace plans, you do not have to be healthy to consider it. But here's the deal, folks. Just like I was looking at yesterday morning, oh my gosh, 8:30 in the morning, and a client calls me and she says, Diane, I've lost my group insurance. Does that give me to be able to be enrolled in a marketplace plan? She was not offered Cobra. So yeah, we were able to get it. And I said, what's going on? And she said, well, I've got some health issues. And I said, okay. I said, let me ask you some health questions. I did. And we realized, okay, she's got to go into the ACA. Which is also synonymous with Obamacare, also synonymous with healthcare.gov, also synonymous with marketplace or major medical for the under 65, non-employer based. I mean, it has 50 million descriptions for the same thing. We all cannot decide what we're calling this thing. Let's just call it ugly.
Yeah.
The ugly.
I love it. That's true.
I'm teasing. I'm teasing government. Please don't be mad at me, Uncle Sam. So anyway, what we're looking at here is, so she said, she goes, what is it that I can get? And I said, well, you can get a $7,500 deductible, to start with, on a bronze plan in the St. Louis area, because all the exchanges are different across the country. And I said we could probably cover that with an accident plan for you. So if you have an accident, that $7,500 is covered. I said, and we can try and do the underwriting and see if we can get you into either a hospital plan or a fixed benefit plan to go with it. And she said, okay. She said, is all my preventative covered in that plan from the government? And I'm here to tell you, preventative is covered in those plans, in major medical plans from the government, as well as through the group plan. Now, preventative, pregnancy, and pharmacy are not always covered in the catastrophic plan. Remember, you got to be healthy to get those plans. So, so pharmacy becomes one of those tricky things when you're looking at a catastrophic plan. Sometimes they're covered, and sometimes they'll say, oh, generics are $25. Hello, folks. Let's just talk here. Get on GoodRx. If you don't know how to do it, reach out to one of us. And I mean, Pam is shaking her head right now.
I use it instead of my insurance, and even
yeah, it's great.
Tell people all the time.
It is awesome.
Yeah.
And Kathy knows too about, Mark Cuban, but being involved in NABIP and the National Association of Benefits and Insurance Professionals. Mark Cuban was at the conference this past summer, and he said, I'm here to F up the system. And we were like, what did he just say? What? And so his system is pretty remarkable. It's one where Kathy's raising her hand. Did you have something to say, Kathy? No.
No, I was giving you a thumbs up. I
right.
I'm doing some
Mark, give it a thumbs
reactions
up.
out
No,
here.
that's
I'm
a
telling
finger,
them
you guys.
that that's a great thing right there. So I'm
Wrong
putting some
icon,
reactions
Kathy.
in.
Oh my gosh. So
Anyway.
he was just completely, he was disrupting. He wanted to disrupt the whole thing, and he had. And so his cost plus, cost plus drugs is a great way to do it. And then I met this wonderful person. Her name's Amber Monsalve, and she's with the Canadian drugs that are out of Tampa, Florida. You talk about a wonderful person. She was like, we were at a conference this past summer. She said, what are your clients paying for Eliquis? And I'm like, what are your clients paying for Eliquis? She said, oh, through my system. She said, a 3-month supply, we can get it for 154. And I'm like, are you kidding me? And so, I mean, these are things that we all have, in our bag of tricks. So if you don't have these things in your bag of tricks, reach out to us or to me, and I will make sure that you guys have this, because those people that are going on catastrophic, they will ask, well, how do I get my drugs? And you've got to ask these young ones. You got to say, are you going to have a baby anytime soon? Because if you are, this is not right for you. So the 3 P's are not in the catastrophic plans. That is preventative, pregnancy, and pharmacy. Those are the 3 P's that aren't in the catastrophic plans. Now, I say that because there's always an exception. And there is an exception to a catastrophic plan that does include preventative, but you pay a little bit more for it. So let's talk price. Catastrophic plans are typically half the price of a regular priced healthcare.gov plan. Okay? Well, let's keep that in mind. So they're typically half the price. Why? Because you're not paying for the pharmacy, you're not paying for the pregnancy, and typically you're not including the preventative in your plan. So it's saving that money. And because of that, it's half the price. Now, every 6 months, if you do a 6-month plan, you got to remember to get your plan again and to sign up again. It's not a year-long thing unless you're in a state that has a year-long opportunity. or you go into a 3-year lock into that plan, which is more expensive than the 6 months, of course. But hopefully you'll look at all of that and you'll see, because the question that we ask people is, what's your budget? And that's not an invasive question or evasive or invasive question. It doesn't, I tell my clients, it doesn't mean I'm going to spend that money. It means that I will get you the best for that dollar, because we have hundreds of scenarios that we can put you into. So tell me where I'm starting. And then they usually will say, start with the cheapest. Okay, the cheapest for you is going to cost you the most. That is to go without insurance. And then when it hits, you're going to be hit with tons and tons of debt. So let's talk about that scenario. And let's talk about the fixed benefit plan and what it can do all by itself. Because of this wonderful friend who has enlightened me, and she said, Diane, there's this thing called charity care that every hospital has. And on the fixed benefit plan of Manhattan Life, they actually have advisors that you can call. And you can ask them, where can I go to get the lowest price MRI in this zip code? It could be anywhere in the country. And they'll say, you need to go to so-and-so. So the hospital price in our area for an MRI was $2,000 for a client. And I said, call the advisor from, the Manhattan Life, that partnership that they have, and call and ask them where you can go. And they went to a private MRI on a different location outside the hospital. It was $381.
I believe it.
So price transparency. Let's talk about this. This was an issue that we spoke on 2 weeks ago, last week, when I was at the Capitol with about 9 others from Missouri and 800 other brokers and professionals in the industry across the country, talking to our legislators as one voice, as NABIP, National Association of Benefits and Insurance Professionals. 3 of our talking points were about price transparency. So, number 1, this is what I learned. You have got to get a prior authorization, even though you're thinking that provider is going to get that prior authorization. Well, they need to have it so that the insurance will work with all of it, but you need to get the prior authorization from the insurance company and what you have. And if you have a company available to you that could shop the price, you need to tell them, here's the code, here's the description, tell me where I can get this the lowest price. Because sometimes when you're at the hospital, it's more money. If they have a satellite, it's less money. If you're at the doctor's office, it's even less money, depending upon what you do. Now, let's talk about charity care. Charity care is a certain amount of money that the hospital has that they can write off every year. And you have to qualify for it with income. And your income levels allow you to get it. So some people, if you don't make, in most states, $24,000 a year to go into a major medical plan on healthcare.gov or in your state.gov, then what happens is you are sent to Medicaid. Typically, to qualify for Medicaid, you need to make less than $2,000. You can keep your house, you can keep your car. And that's all you have. You don't have any other assets, and then you would qualify for Medicaid. Now, there are other ways to qualify. And I know people are hearing this and going, well, there's other ways. I'm just giving you the roundabout. I'm not giving you all the ins and the outs. I'm just giving you the lay of the land, not the landscape. Okay. So what happens is people are caught in the middle. They don't qualify for Medicare. They don't qualify for Medicaid, but yet they're low income. And that's what we're talking about with charity care. So what happens is if you have a fixed benefit plan and you are paying that fixed benefit plan, that is not considered health insurance. It's a fixed benefit. Catastrophic care and catastrophic insurance, the short-term insurance that lasts 6 months, or it could be a tri-term insurance, that is not considered insurance. Here's how it works good for you. You don't have to tell the hospital that you have insurance. You do not have to tell the hospital you have insurance. Anything the hospital wants you to sign, don't you sign it until you've read it all. Don't sign it. And because they might ask you for an upfront payment to be seen, and you want to see it in writing where it says that you have to do that. Okay? Because just read everything. Now, because you don't want to sign away that you don't want to choose charity care for later, because you might tell them, I don't have insurance, you're not going to give them your cards, and then when you get the bill, you send the bill to your fixed benefit plan, or if you have a catastrophic plan, you send the bill to the catastrophic plan, and the money comes to you. Otherwise, if you give them those cards, the money goes to them and you have to go get your money. Now, that's not fun. That's not fun at all. So avoid that. So what a lot of people are doing in America, they know about charity care, they know about where they're gonna meet in their socioeconomic level. And so they get a fixed benefit plan, and that benefit plan comes to them directly, and then they can choose to use that to pay the bills, or choose to use it to pay anything, or choose to use it if they even are billed, or they can bargain with the hospital to see if they can use charity care. So always, always, always ask your hospital, do you have charity care? And what are the stipulations to qualify for it? And if you have a fixed benefit plan, you have a way to call an advisor on that plan, like Manhattan Life, for example, Affordable Choice, and they have a partnership, and you can call and you can ask, where can I go to have the most for the dollar? And you also have, through Manhattan Life, a script like that too, where you can go RX scripts and see where you can pay the least and get your scripts. So they will do all of that research for you. It is a benefit of having the fixed benefit plan, which I absolutely love, and I hope you do too.
Nice.
Kathy, what questions do you have for me before I go on?
Well, wait a minute. Yeah, you knew I was going to have questions, right? Okay. So the questions that I have, I moved from one place to another in the house, so forgive me. So
Keeps it
it's always
exciting for
something
us.
here. Okay. Yeah, well, just try to get in a spot that I can make sure I'm hearing all of this wonderful information. I want you, because I wrote down a couple of points here, and I want you just to um, basically go back over when you told us about the Manhattan plan, Manhattan Life plan. It's the fixed benefit, correct?
Yes, affordable
Okay.
choice.
Okay. And you are the classic you mentioned and the affordable. Tell me again the benefit of that affordable choice Manhattan Life plan, and all just kind of the quick overview again. Was writing things down, and I wanted to make sure, because I heard you talk about admission, I heard you talking about the number of days that you're in the hospital, and how all of this can basically develop a better strategy for your client. I always say employees, please forgive me,
No,
for
but
your
you can do it for
clients.
the employees that are under 65, Kathy, because they do a list bill.
Yeah, that's what I'm thinking. So if you would just hit it again, just so I've
Sure.
got it, how the affordable choice Manhattan Life plan for under 65, how that actually fits and what's available.
Okay, so what you want to do is for everybody, and I'm going to take everybody through this, and Pam can do this too on her phone, and Kathy, you can do this too. You want to just put in your Google search, you want to put in there Manhattan Life. So just type in there Manhattan Life.
Uh-huh.
Affordable Choice Enhanced.
Okay.
Choice enhanced. And then you want to put PDF,
PDF. Okay.
and then it should pop right up.
That should be perfect.
Okay,
Okay.
so once you pop it right up, like mine, do you see my phone? I don't know if you can see it, but it says the Affordable Choice Enhanced, and it has the brochure right there. Are you able to
Got
see
it.
that?
Got it.
Okay, so the first page, it says the Affordable Choice Enhanced, and then it says our commitment. And then they do their brag letter about that. No deductible or co-insurance, hospital admission benefit, cancer benefit, which I didn't even mention, which is $1,000 a day for 40 days for treatment. And then the first dollar doctor visits. And that's perfect because that catastrophic plan that I was talking about, that short-term medical plan, they typically do not cover doctor's visits. Now there's one that does, but a lot of people don't necessarily choose that one.
Okay.
So then, because it would be the one that does is the $5,000 plan that has 100% match after that. And that's with Allstate National General. And they include the doctor's visits. And
Okay.
that one also includes preventative. So
Okay.
to compare it in St. Louis for that family of 3 that I looked at yesterday, and it was he's 50, she's 49. They have the son that's 11 years old. That plan without the preventative and without the doctor was $931 a month in the St. Louis area for UH1. And then with the doctor visits and the preventative, then it was $1,239 on the and it was a $2,500 deductible for UH1 with 100% paid after that. And it was a $5,000 deductible. And only the person has to meet the 5,000. It's not an aggregate, 15,000. It was just a person.
Okay.
So that was the $1,239, just to kind of give you an idea. Now,
Yeah.
on the marketplace, when I priced that out for them on the marketplace, the entry level marketplace for them for 7,500, with 10,600 being the maximum out of pocket for the family. And then the doctor's visits on the marketplace were going to be $50, and the specialist visits were going to be $100. That was going to cost them $1,813, just to give you an idea.
Yeah.
So it's kind of, it just depends on how you build the plan to, but it's significantly lower. So what they did was they decided to go with the one that has the preventative in there and also has the doctor's visits in there. They went with the National General for $1,239. They added a accident plan for $25. And then they could get a classic plan through the fixed benefit, the Manhattan Life Affordable Choice, and it's $303. So they were still hovering around $1,500 for the month, but they had so much better coverage because
Gotcha.
they were healthy and they could
Right.
do it. And he was just like, Diane, this is amazing. And I said, as long as you understand the moving parts. And that's why we have this worksheet, so they can have it all on one page and not thinking, well, what do I have? What do I have? And so with this, I was able to send them, what they decided on, and then also send them the brochures. Yes, Kathy. Yes, yes. Send them the brochures that went with each one. And so on each brochure, I was able to put that, the dollar amount per month. And then at the very end, I told them, okay, this is what you're getting. This is what you're getting. Even though, everything is going through online with all of this, and they have to sign for everything, on their end, I still wanted them all to have it all in one spot. So when they go into their email and they have a question later saying, well, what's my coverage? What's this? What's that? I can just go in and say, just put in the date, 3/5 of 2006 health insurance bundle, and then they
Hmm.
can pull all of it up in one
Okay.
spot. So it works out really well. So your question though was the fixed benefit. When you go into this plan and you see it online, and if after the My Commitment page, it gives you examples. If you would have like the elite plan just by itself, or if you had the classic plan, or it gives you another elite plan, and then
Okay.
the elite plus is in there. So you can see on the page, I'm wondering if we held this up, if everybody can see what I'm seeing. Can you hold that over
Yep.
to the screen? Can everybody see that? Can you see it, Kathy?
Yeah.
Okay, so that's the page we're talking about in that PDF. And the classic plan is all the way over on the right-hand side. So y'all
Gotcha.
can see how it bands up. It starts at $2,000, but by year five, I mean, that's the year to go and get some stuff done with that plan. That's $4,000 a day in the hospital.
Nice.
I would be
Yeah.
like, let me stay.
Right. Leave me alone. Right.
So 3-day hospital stay. Hello, $12,000.
Right.
All right. I'll take that $10,000
Right.
max out of pocket.
Yeah.
So I mean, it's just
Thank you.
amazing.
Yeah, that's I heard what you said, but sometimes you know how people say some things are just sounds too good to be true. Say, well, the problem is you need to repeat it so you can actually hear it again
Oh,
and confirm
absolutely.
it. So it's not just hearing it the first time, but seeing it and having someone explain it to you. So you've done all of that. Thank you so much. And I'm going to come off the camera because I like to watch you as you talk.
Okay, so everybody knows where to find that. Now, as you go down, the next page that you see after that, if you guys are looking at this too, you'll see the affordable choice monthly premiums, and you can see how great those are. But don't forget to go back up to the previous page and just ask them, how are you using your health care now? And figure out how much they would be saving for the year based on, those plans. So, sometimes people choose the classic plus, sometimes people choose the elite. Sometimes people have chosen the elite plus to go to partner with their insurance. They just go with a really huge deductible at that point because they're going to make it up. So you just have to kind of play with the numbers to see, what works for you. But I absolutely love this plan. Please, Manhattan Wife, don't ever take this away. So then you get into the low cost diagnostic imaging that they do have, and it is the First Health Network, so you always got to check the network. And then you also have the prescription benefit on there. Excuse me, it's called Redo, and then you have Teledoc, which is also on there for free. And you can use Teledoc for both a mental health and behavioral health, and also physical health, whatever you might need. And typically they'll call within a half hour if it's physical, and within an hour when it's for mental health. And then the health advocate is there for support of making decisions for any medical condition, as well as researching, as well as medical bill saving and RX shopping. And so it's really those things partnered with it really make this exciting, because even if you have the fixed benefit plan, these are the components of this plan, with the fixed benefit plan, that you're going to enjoy and save more money while you have another plan that it's sitting on top of or by itself. So hopefully that helps, Kathy. Give me a thumbs up if it does. So some of the other things that we want to talk about. So we talked a little bit about the catastrophic short-term plan and what makes it different, with the 3 Ps not necessarily being in there, which are the prescription, and the pregnancy, and then
pharmacy.
also pharmacy. But sometimes, not pharmacy and prescription are the same, but the preventative. So, but some of them do have that. So you got to look for that. And then you also have the right here, the employer plan. Now, I will let you know that, this is probably gonna blow Kathy's mind with this, because she does the employer plans. And that is, knowing that you have a list bill available for the Manhattan Life could really be a game changer, because if someone has that, they could choose to have a much higher deductible on purpose. And then they could save a lot of money themselves, while the employer is saving a lot of money too. So the employer could choose to help amplify that fixed benefit plan as a benefit, or they could choose to use that as a way to set themselves apart, and say that they could list bill it, or they could use it as a benefit in addition to what you're doing as their employer representative for insurance. So it's really up to you how you want to position that, but how I usually position it in my life is just to individuals. But my goodness, is there an opportunity to really go in and educate the employers? Because if they're doing that in the under 65 and they're used to having that supplemental coverage, which I've actually called it like Aflac on steroids, that then when they turn 65, then they're probably going to be more prone to have an Advantage plan or a Plan G high deductible, where you have that wraparound with the hospital plan. Because I see that with my clients now, the ones that have had the Manhattan Life, they're like, well, where's my Manhattan Life? Where's my plan that I love? And I said, well, you're going to fall in love with GTL or Mutual of Omaha as your hospital plan. That's what you do now when you're 65. So they're already in that mindset. So Kathy, this is huge for you. Oh my gosh. Oh, I love it for you. So over here,
I'm loving this. Okay, I'm sorry.
you're loving it too.
Yeah, that's why I try to stay off and stay muted, because I start saying things and it's like, stop it. You're having a good time, enjoying what you're seeing. So, but I do. I'm over here. I'm like your cheerleader. I'm like, oh my God, this is just so one. This is wonderful for
It's
us
just
to have
awesome.
in our tool belt, right? As
Yes.
brokers, we need to be able to do just more than provide one or two options. This is about creating strategies and solutions, and I'm loving every moment.
Oh,
So
I'm
I'm going to
so
get off of
glad.
mute
I'm
Me
again.
too. A
so
Okay.
lot of
glad.
new
A
strategies. I
lot of
haven't
really cool
used any of these.
strategies.
Yep.
Yes. And so the other one here, it says group health and major medical. So last year, there was a pause in the catastrophic short-term plans, and I freaked out. I was like, oh my gosh, well, now what? Now what? Well, now we have to take everybody through, the marketplace. You got to be kidding me. And
Yeah.
as everyone probably knows, the marketplace with me, I don't go in as a broker. I actually go in as an advocate. And so my company called Comprehensive Health Advisors, it's an advocacy based company. So I go in as an advocate, and then in our state in Missouri, the under 65 allows you to have a consultation fee. So not all the states allow this, and nobody allows the consultation fee for any over 65s. Nobody can charge it. So, but for me right now, that's how I've been able to do it, because I found that when I take people through the marketplace, I'm seen as a competitor. And so, because they're trying to get your business and they're trying to make a profit on your business. So when I go through as an advocate, then I'm able to actually get some things done, and then they're able to get credit for the sale of it, and then I'm able to get compensated as a consultant. I would hope that someday that will be seen as a value for the over 65, but it hasn't been yet, and it hasn't been seen like that in every state. So anyway, I'm telling you guys this because you got to tread lightly on this one. You got to make sure it is legal in your state to behave like that. Otherwise, you can get yourself in trouble. Oh my goodness. So, with that in mind, last year I found out that the catastrophic plans, they were like gone, and we couldn't do any of the short term. And I said, what in the world are we going to do? So I got into class and I went to go see Joe Crimolo. And Joe Crimolo is the leader of Compass Health Consultants. And they're located in Cottleville, but they have offices in Boston and also in Tampa. I think they have offices at other places too. But anyway, it's a huge organization, used to be part of Health Solutions team. And I said, Joe, what do I do? He goes, you get in my class. And I said, okay. So I went there for a weekend and my mind was blown because this is unbelievable. There are two companies right now where you can go in and you can get underwritten, and then you're attached to a corporation as a 1099. And basically, what they say is you're a 1099. We're going to send you surveys once or twice a month, sometimes 3 times, maybe not at all. Maybe you don't fit the description. They don't want your data. And so far, they only wanted my data once. So I don't fall into many categories, obviously. And so, anyway, I said, well, how does it work? He goes, it is group insurance, Diane. And I'm like, what? He goes, well, with one of them, he said, you're going to be part of ADP, their group insurance. And you're going to go in and you're going to be a 1099. And it is a nationwide plan. Okay, so let's talk about this for a second. Catastrophic short term is nationwide. As long as you're in the network and they're in the network, you can go anywhere you want to go. That's how dental works too, folks. You know, PPO, you can go anywhere. And then with the marketplace, you are in your area. That is where you are. And if you go outside of your area, you might get covered, you might not, probably not. They do say that you do, but I've never seen it. I've never experienced that myself. But, when I was in Colorado, I still had to pay out, my own pocket. And they said, oh, you're covered if you go out of the state, for an emergency. Well, I don't know if they just didn't cover it as an emergency, but believe you me, it was an emergency. I broke my leg. So anyway, so the marketplace is really made for this area that you're in. It really is not the state that you live in, it's the area in which you're in. So you really have to check the doctors and the network. In St. Louis, it's so weird because we have one network where Mercy is preferred, and we have another network where BJC is preferred. If you're not from here, then just know those are the two biggest hospital systems that we have in St. Louis. We have like 5. And so it's one where people are like, I have to pick, but they're run differently. One's a teaching hospital, one is not. One's a conglomerate, one is really not. So it works differently with the networks. So with that being said, this group insurance, I go to this meeting and they say, yeah, you could be in a group. I'm like, how in the world? And they said, well, they hire you like a 1099, and then you get these 1090, you get 1099 at the end of the year, or you might even get a W-2. They might just hire you as an employee, and depending upon the company. And I'm like, what? And this is something that we have tried to do in this industry for years. Well, then they said, well, whatever you do, don't tell them that it's Blue Cross Blue Shield as your network. I'm like, what in the world? And they said, oh, some agents, they've been saying that it's the Blue Cross Blue Shield network. No, it's not. That was Blue Cross Blue Shield And that's what they said. They did say and specify it was just the network. So these plans were getting in trouble right and left because everyone was like, "Oh no, this is the latest and greatest. We got to dismantle it." And so Blue Cross Blue Shield red flagged, and then the other two companies that were in the network, Cigna and PHCS, we learned from Blue Cross and Blue Shield, they work great. And I'll tell you who works really great is the Cigna network, because the Cigna network is the one where you can see the stamp, and then when you go to the providers, they can see the stamp, and that works great. The PHCS in our area, not so much, because there's a whole bunch of PHCS, and they're like, which one are you? And so it's like, okay, this is a big rigmarole, and then you got to go through sending in your receipts, and then getting money back, and no one likes it. But the Cigna, pretty interesting. So if someone comes along and says to you, I love my group plan. I don't want to have a marketplace plan. No, I don't want to do this. I'm not healthy, or I don't want to do a catastrophic plan. I wish I could have group insurance still. Well, guess what, folks? Right now, you could. You could do it. And what's crazy is that you can choose your deductible, just like a group plan, and you can it works just like a Cigna group plan. It is amazing for people that understand it. So I read all of the disclaimers to them. I'm like, this is what you're getting into. This is how it works. This is why it works. This is because it's weird, because no one else has heard of it. But it's one where once you go through everything and someone says, yep, that's exactly what I'm thinking, that's exactly what I'm wanting to do, then they're fine with it. But they got to know what they're getting into. You cannot pull the wool over any of these eyes, because too many eyes are on this product. But it's out there and you need to know about it.
How do you feel like it ranks compared to the other ones?
Well, as I said yesterday, we're finding the best of the worst here, folks. Nothing is perfect. But I will say that their customer service is very responsive.
Oh, that's good.
So I like that.
Mhm.
But you have to know, okay, this is where the bill is coming from, from this company. This is the insurance that you have. This is where your money is going to be distributed when you have a claim. So you kind of have to know who all the partners are to make this wheel turn. But once you know, and once the clients know that, they're like, my gosh, I'm back on a group plan. But again, it is strict underwriting. It is strict. And what's really funny is, some people have kind of flubbed it and said, oh, they don't really, they had our tech 2 years ago. They're better now. Oh my gosh, they have been red flagged. So they'll catch it, so it's because they want the healthiest of healthy people in order to keep that price down. So yeah, to kind of give you guys an idea. So I've had that plan for the last year, and that particular plan for me was $689 with a $5,000 deductible. Period. The end. And it was a major medical plan, so it covered. It's not going to cover pregnancy on me, but it does include that for other women. And then also it has the pharmacy benefit in there, and then that's a little tricky to set up too. But once you know how to do it, then they're fine. And then the other is, of course, the preventative was in there as well. Now I'm on a marketplace plan. My premium is $13.81. So my deductible is only $25, and my deductible is $0, and then my max out of pocket is $7,800. So it's kind of like, okay, which one do I want? So
as soon as you use one of those private plans, then I got kicked off. That's what happened to me. So, just running and everything turned out okay, but going into the emergency room and having test run.
Yeah.
And then the next thing I got kicked off. So that's what, I was just curious.
But I will say this, if you pay your bills, but if you don't pay your bills, you're kicked off. I mean, that's the way it is. If you don't pay, you're done. So for example, this is why I got onto
ACA, yeah.
well, I was on the ACA and then I had the private plan. And so I got married. And so I called them, I called healthcare.gov and I said, I got married and I need to add my spouse. And then Eddie said, no, 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 don't add me. Don't add me. I'm on Cobra. And I'm like, okay. So then I take Eddie off and it kicks it to where a month later, they thought that I was going to pay so much and it all got confused. And then I couldn't catch it. And then I'm like, oh my gosh, I have got to have insurance. And so
Yeah.
I went on this group plan and I have had it until January of this year when I got back onto the marketplace plan. And I was just like, holy cow. And Eddie the whole time goes, you still have your fixed benefit, don't you? And I'm like, yes, I do. I have Manhattan Life.
That's
You
good.
still have your
Yeah.
home care, don't you? And I'm, yes, because you still have your dental and your eye. Yes, you still have your accident plan. Yes. And then he was like, you still have your long-term care. Yes. It was just that piece.
Mhm.
So, but this happens to other people when you
Mhm.
try and adjust something in the middle of the year, it all gets messed up. But it was messed up because they thought that I needed to pay more, and in actuality, I needed to pay less. And then you have to argue with them. So the rule of thumb is once you get it set for the year, oh my gosh, just leave it set. Don't make any changes to that marketplace plan.
See, I was gonna go and do all the fixed indemnity and things, but I'll leave the
No, add the
marketplace
leave the
alone
marketplace
until
on
next year
sure.
and revisit.
Oh my gosh.
Yeah.
Oh, that thing. Just let it set. So, okay. So questions about any of these plans?
If we did want to do that for one of our clients, where would we get the information on the group?
From me. You
Okay,
call me and say,
okay.
Diane, I need to get licensed and
Okay.
then I'd get it for you.
All
So yeah, absolutely. So
Perfect.
yeah. So Kathy, if you have someone, just really clawing at it and going, I really, really want that a group plan, let me know. Especially for the under 65. You have that young spouse. So
I have another friend who represents a payroll company and they're getting into that business. I should have them come talk to you. Sounds just like what ADP's doing. And so since they've already got the payroll, they're trying to get.
that is the company. That's the company that they go through.
But no, his isn't ADP. His is a different.
Oh, okay.
Oh,
Okay. Oh,
I'm going to jump in on that statement. You have to remember that as a broker, and if you're talking to ADP, Insperity, or any of those companies, they see you as a competitor. Therefore, don't be too magnanimous in providing information to them because they will cut your throat if they could.
Yeah.
So,
I love how she says it.
So let's stay with the independent brokers, share that information with them if you are, in the sharing mode. But let's not get too far afield with what we're doing. Okay, that's just a
Good point.
message.
Right.
Yeah,
They would just
a word
we
to the
can do this
wise.
ourselves. We don't need you.
Yeah, they'll take your business as fast as they can see it. Okay, so just a word to the wise. Stay with the independent brokerage network.
It's so different than individual. It is.
Yeah.
It is. It is.
Very
It is
different.
terribly different. It is really, really different.
Kathy. I mean,
We'll
thank goodness you are so savvy.
Yeah, we'll have to talk about it. I sometimes have people ask me about group, and I get referrals from a group. So
yes, but you also
it
have to know
doesn't do
that
Medicare.
Kathy is the wife of a lawyer, so she has some extra.
Yeah. All right. Good
So
to know.
just be careful.
Be careful is right. They like us today. They like us tomorrow.
Yeah.
They just like what we have to say.
Here's what
They go, oh, I like that for myself. Oh my
here's
goodness.
something
That's
that I
hilarious.
think.
Okay, so that kind of I think we have gone over all of these things here. So for this 60-year-old, the husband, if he's healthy, and you pick, what do you think? What do you think he should do? He's healthy, and he really doesn't want to spend all the money that a marketplace plan is. He's told you, and he's like, and I want to be able to go anywhere if I get sick. So what would you do? What combination? What do you think, you guys?
I would probably do a TRICARE and then later on.
Tri-term?
Yeah,
Uh,
TRITERM, I'm
uh-huh.
sorry. Yep,
Uh-huh.
for United, do that one and then
Uh-huh.
layer it with, some of the fixed indemnity plans.
Mm-hmm.
So,
Yeah.
mhm.
Kathy, how about you?
Well, okay. What I would do is be very careful of what we're um, looking at. Okay. And the reason I'm saying that is there's so many exclusions that sometimes you miss.
Right.
And what we don't want to do is to suggest to a client that we haven't gotten enough information about what they have. If it's somebody really healthy and all of that,
Right.
yeah, the TRICARE would look. But I would say in our
Doing it.
Tri-term. Uh-huh.
it's not TRICARE. That's something else.
Tri-term.
I
That's
did
a
it. Now I got
tri-term.
you doing it.
See, I'm
Yeah.
following the wrong kind of prompts there. I'm sorry. So I think what I would do is for that individual that's under 65 of the one that's going to be eligible for Medicare, right?
Right.
That's the one we're talking about. First of all, I would see if that individual has any health issues. I would have the employee that is turning 65 to go to their HR department and talk about getting their spouse under, there would be on Cobra.
Right.
They're eligible. Once an individual is eligible for Medicare, any of their dependents can still remain
Yeah, I
on
didn't know that.
Cobra
Yeah.
and find out what that price is going to be, because that would be a continuation of their
Sure.
current benefits. So that's what
Sure.
I would do.
I
Now,
agree. I agree.
okay, that's
And then I would compare it if they're saying if it comes out of their mouth and they say I don't want to spend all this crazy money,
there
on
we go
Cobra.
over the Affordable Care Act. I'd have them look at that, see
Mhm.
if they would qualify for a tax credit. I would still
Right.
run that. And
Mhm.
then once I would run that, if it's like, I don't know, then I think I could go to tri-term.
Right.
Tri-term, because that's where all of that is starting to uh, kind of coalesce into, that's your third option.
Right.
So that's how I would look at it.
Absolutely.
Yeah.
Yeah. It's
Mhm.
so it's fun to look at all the options but again, it's that question of what's your budget?
Mhm.
And I'm not going to
Mm-hmm.
spend it, but I want to make sure that you get the most coverage that you can possibly get, the best coverage for that dollar. And once they understand that, then it's like game on. And I think that, I will sometimes, send this worksheet out to them and put disclaimer and just say, don't be overwhelmed by this, but this is what's on my mind. I'm trying to navigate through this for you. And then just that one page gives them an idea of how much work, that brain work that we're doing in order to come up with the very best thing for them. And then also to let them know that this is what's right for you right now. But if something changes, then we rework the whole puzzle. So meaning like my client last night that I was telling you about, that's 50 and his wife is 49 and their son is 11. In 6 months, they're going to be living in another state. And he said, so which one can go to that other state? And can I go to all of those hospitals? And so you have to ask people, are you traveling or do you travel for work? Do they need to have coverage that is outside of the area? And so if they are doing a marketplace plan, they need to know that if they get sick outside of the area, they are supposed to have emergency care, but the emergency care will get them well enough to bring them back to St. Louis to the care that they're supposed to be receiving here, because it's negotiated to where that is the care costs that they should be receiving, and that they've done all of that already in their back offices. So always ask that question too, of the over 65 and the under 65. Are you traveling?
That's a good point.
Are you
Yeah.
going to live 6 months one place, 6 months another place? Because when I was traveling back and forth to South Carolina to see Eddie, basically chase my man before he became my man, my husband, I was like, okay, I have got to have something that will travel with me. And so that's when I had the catastrophic tri-term plan. I had catastrophic at first and then a tri-term because Eddie was like, honey, you've got to have something that covers you in South Carolina and in St. Louis. I said, you're just thinking I'm flying every time, honey. What if I'm in Tennessee and I need it? Or if I'm in Kentucky and I need it? And he's like, get something.
Yeah.
Like, okay. And so, you can do that, which is great if you have the health and just figure it out and have the conversation of what applies to them.
Yeah.
So, because Kathy, I'm sure you come up with that a lot when people are retiring, they want to travel. They want to go places.
Absolutely. Absolutely. And that's why it's so important to ensure that you are looking beyond just where they are right now. You've got to ask those questions. We've got to make sure if they're traveling that their coverage is going to go beyond and help and cover them no matter where they are. So that's critical, critical, critical.
So a lot of my clients, they like to travel abroad. And I'm just gonna put this out there for y'all. And that is, I always ask them, okay, I'm not gonna make $1 million looking at your, travel plans or your travel insurance, but I want you to have it. And I want you to take it because it's going to probably be cheaper than anything that they can get out there. But it's the medical travel piece that is important, the repatriation back into the States, especially if they're going on a cruise. Because there are morgues on cruise ships, and then that will get you back to the United States, and you need to know if that transfer is there when they hit the ground of the United States back to your home city. So sometimes that travel is not included in there, and that can be very, very expensive. The other thing to look at is to see that they also are going to be COVID covered in another country. That's something that's come up very recently. And so the two companies that have that travel for both over 65, they have like a Globe Hopper travel plan, and that one is IMG Global. And then IMG,
Okay.
yeah, International Medical Group, IMG Global, and then the other one for under and over is Geo Blue. So, for example, some of the travel companies that will have travel insurance and have medical insurance, and just with your medical insurance, and people will say, "Oh, but I have medical insurance that's going to be for international." Okay, it says that. But the problem is they're not always open the hours that you will need it. So, case in point, had a client that broke her leg on a Friday at 5 o'clock in Africa, in Ethiopia. And she could not get it set until Monday at 9 a.m. Eastern Time, when she was able to speak with the person that she needed to in order to get it approved. True story.
Mm-hmm.
So do not do that. See if you can get a Geo Blue plan, because they're open 24 hours, and so is IMG Global. And then they can negotiate that, and her leg would have been set that Friday night, and she wouldn't have had to stay in the hospital. So basically, when they show this scenario, Geo Blue showed this scenario, and I never thought the scenario would actually happen. Oh my goodness. And they said that typically you save about $40,000 by having your regular insurance and or Geo Blue insurance and with them, or IMG insurance and with your regular insurance. So I just want to put that out there too. The other thing that I want to say is I had a friend who dove into a water, and while on vacation in Cancun, he had had a few too many, and I was not on that boat with him. I was here in St. Louis, and he ended up in a halo, and he had to be transported by helicopter to the United States. He went over to El Paso. I don't know why he didn't go to like Harlingen or something like that. But that plane, or not the plane, but the cost for the airlift was $48,000. So definitely make sure that in your travel policies that you do have airlift in there. It's really important. Also, there are companies now in the St. Louis, out surrounding St. Louis area, rural areas around the United States, where they have airlift, and it's only about $200 a year. If your policy that you have is not covering airlift and you're in a rural area, oh my gosh, you need to look into to these. Now, no, you need to know that this is like my commercial on it, because as brokers, Pam, me, Kathy, Courtney, we only make about $5 on these policies, but you need to know about them because it will save you a lot more than $5, and you're important to us. So you need to know that we know about this, and so we can kind of point you in the right direction. If we can't get you signed up directly for it, we can certainly point you in the right direction. And it's just important to have it, because the last thing that we want to find out is that we could have helped and we didn't know about it, like in the cases that I was telling you about. So anyway, Kathy, do you want to say anything more about that? She's like, no.
You know, I start talking and then I realize that I am muted. So it's like, okay, it's what most people probably always want to do to me, which is mute her. But I think
No.
that I think it is absolutely critical. And I'm so happy that you mentioned that. And some of the some of the countries that you mentioned about traveling outside of the United States, individuals think that they have coverage, but you can go just as far as just to Mexico, which isn't that far.
Right.
And I had a friend who was going to Mexico, and on her way, she dropped something on her foot. It created another issue. She's a diabetic. She wasn't doing what she's supposed to.
Oh,
But
goodness.
she thought her insurance would cover her. And they basically, it was almost as though they held her ransom in the hospital. You know, it
Right.
was like, if you don't
So they
pay us
get
this,
paid
So they
of
get
some
their
right,
sort.
money.
Yeah.
we
That's
won't
what happened
release
I
to
you.
believe it.
my client in Ethiopia. They
Mhm.
wanted their
Exactly.
money.
And so, thank goodness, that was one of the few times that she actually listened to me. And I had her to purchase I'm trying to, the travel, I think it's Travel Guard. I think that's the one
Oh yeah.
that she had a policy, but as long as it's a reputable company from that has your travel coverage and has medical, it's not just enough to cover, losing your
Just the
luggage.
travel.
Right.
Mhm.
So this, you want to make sure that you have that coverage. And I think there's also international, who did you mention? Um, for a policy. Is it oh gosh,
IMG,
IMG. Yeah.
or Geo Blue. Either one.
Absolutely. Those two. I know IMG because I've had folks go to Japan and stuff. I'm like, buy this policy. I don't want to talk to you about it. But anyway, she had purchased it, and that she was able to get out of Mexico because she gave them her card, the
Right.
Medicare and everything, and they were like, nope, we don't handle that. And they told her, I think it was, and I hate to misstate the number, but I think it was they wanted about $23,000,
Yes.
or they were
Yes.
not going to release her from the hospital, which means that you're locked up
Yes.
in Mexico in the hospital. Okay. But she had her coverage. That information, well, she called me and I was like, oh my God, what are you doing? So I got in touch with, it was IMG.
Oh, that's so
And
good. Pam, what were
what's
you gonna say?
Oh,
really
I was gonna say, and
cool,
a lot of times your credit cards don't work if they say my
oh,
healthcare covers it. I've been down to Mexico and they put a block on it thinking it might be fraud. So
that's
Yes.
exactly right. If you haven't contacted your um, credit card company and tell them that you're traveling, which is
Right.
another piece of risk management, right? So
yeah.
that actually happens. So if you are traveling, if you are going to Southeast Asia, if you're going to South America, or just to Mexico, you really should have coverage beyond the wonderful
Yeah.
coverage that we're
Mhm.
talking about for United
Right.
States.
Oh, absolutely. So with that in mind, we're going to go into another topic here, and this is one of my favorites. So this is the third worksheet. Woohoo! We're on the third worksheet.
There she goes.
Yes. Ta-da, 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 ta-da.
I have it.
Oh my goodness. Okay, so we have the categories for short-term to long-term options. And that is short-term care, long-term care, and a hybrid life annuity care. Okay, so folks, let's talk about this. Short-term care is a really nice one to talk about when you're reviewing either someone that's going to go over 65 insurance options or under 65 insurance options, because especially if they're taking, 3 medications, you're looking at $30 right there. Even if there's 0 medications, you're looking at $30 a month. That's going to come back to them. That's going to be $360. Most plans are for the under 65 for home health care. They can start at like age 45. Let's just say they're, $27, is usually the price. So if they take 3 medications and they're under 65, then it's a no-brainer, because the money that they put out is the money they're going to get back. They're going to get back at least $300. And so it's going to cost them about, Diane math again, about $60 a year, net cost to have about $66,000 of home health care in their back pocket. So that is a no-brainer. Just add it to everybody. Everybody just needs that. But you got to let people know this is not long-term care insurance. It's not. This is short-term care. This is for you to use as a short term. Now, there is a way, like we discussed yesterday, to stack the policies and to create a long-term option. And so let's talk about that. If you have someone like my dad, and dad was, when he got he was about 78 when he got his home health care plan, a short-term home health care plan, and then he got another one. He had 2. And one of them was going to pay all in total about $112,000 in 360 days, because it has to be less than 365 days that it pays out, and that's what makes it short term. It also, for short term, you do not have to show that you have a propensity of needing care in the future for 90 days. That's what makes it long term. It's not that 90 days has to pass. It's that when you make a claim and you call claims with long-term care, you are telling them, I need care for more than 3 months coming up. And that's what makes it long-term care. Then the company provides plans that are longer than 365 days. And that's what makes it a long-term care plan. It's in that bucket. Then to start the plans, it's really interesting, because long-term care has a waiting period you can choose. Now, back in the day, 1998, you could choose, in the late 1900s, folks, you could choose a 0-day elimination period. And that meant that your plan would start day 1 when you showed that you needed help with 2 of 6 activities of daily living, or you had a cognitive impairment. So the daily living part, and that is your ability to do everything in the morning when you wake up. And that is bathing, dressing, toileting, transferring, continence, and eating. There's a plan out there from 1998 that does not include bathing. So you've got to look at your ADLs. So interestingly, for short-term care, you need help with 2 of 6 activities of daily living, and or you have a cognitive impairment. And it starts immediately. There's no waiting period for short-term care. For long-term care, and the short-term care is going to be less than 360 days. Long-term care is going to be over 360 days, and it's still the same, where you need help typically with 2 of 6 activities of daily living or a cognitive impairment, but you show the propensity of needing care into the future beyond 90 days. That's what makes it long-term. If
Okay.
it's less than 90 days, that's a short-term need. Does that make sense, everybody? Okay. So what happens is, back in the day, it was just traditional long-term care. And traditional long-term care, we're talking the late 1900s, there was about 28 companies. Right now, there's about 5 that are in the market for the traditional long-term care. And it has different definitions. So if you're ever looking at an old policy, you see this old policy, what you want to look for is what triggers making a claim. Is it hands-on assistance of the 2 activities of daily living? Is it standby assistance? So hands-on assistance, that is much, much later down the road. That is someone that has to physically help you into the shower, off of the toilet, to dressing you for you. Standby assistance is you just need someone there in case you fall. So that language is going to determine how quickly someone is going to be able to access their plan. Now, typically what you see with long-term care from back in the day, you see a plan of care that's created for in-home health care. So you have to check, do they have in-home health care, assisted living, and nursing home care, and then anything that would be created in the future, which would be like memory care. You got to look for that clause. So will it cover in-home care, assisted living, or the nursing home care, or will it cover the anything in the future? So do not be confused by the in-home care taking the place of when someone from Medicare comes out to the house. Yesterday we spoke about short-term care. And in-home care is when you have someone come out and you're going to get well. You're going to get well, usually in like 60 days. So that's when Medicare says, okay. And that's when you have a knee replacement, hip replacement, because remember, they're not going to go into the hospital. You know, that kind of went out the window right before COVID, and everybody goes home now. And then you're on your own. You're not even going to rehab. You're doing this, you're on your own. You're getting your own shower, you're making your own meals, you're doing all that because there's no custodial care when it comes to Medicare. They're not making meals for you. They're not doing that. You got to set that all up, you know, neighborhood chain.
And who knows their neighbors anymore?
What we do.
I'll tell you, I know one on each side. That's it.
Meals on Wheels. Hello, Meals on Wheels. That's what we do. I'm getting the nicest person to deliver Meals on Wheels. That's what we did with Dad. And he's like, I don't like these meals. I'm like, you're gonna get them anyway. So
My grandma didn't like them either.
but he liked the person that was delivering them.
Too funny.
So he's like, I don't like the meals, but I like
That's why
you.
they were all stacked. Yeah.
Sunday, Tuesday, Wednesday. So anyway, so what happens is with the short-term care, That one is gonna go in conjunction with the Medicare, most likely. Now, it could be that you start off short term and you're like my uncle and you fall. And now you have one hip that is recovering from being broken or broken, and then another hip that was recovering from the surgery of the hip surgery. Oh my gosh. So now he was long term. So it dovetails into each other if you have both plans. But for those that just have a long-term plan, they're in for a rude awakening because they're not going to be able to get their home health care because they're not going to have the propensity of being able to show they're going to need it beyond 90 days with a knee replacement and a hip replacement. That's why that short-term care is so important. The light bulb,
Those are
the
so
light
much
bulb,
more common.
yes,
The
it's
hip
all the
replacement. It
common
did. The
stuff.
light bulb went off.
The light bulb just, so short-term care is common care. That's how we're gonna remember that. The long-term care is a long shot.
That's true.
That's how we remember that. Because my dad was so mad when he broke his elbow. He had braced mom, and then they both fell down to the ground in between the two cars in their garage. And so dad heard mom, hustling, bustling, and then he ran down there to get her. And they both end up on the ground. One ambulance later, another ambulance later, and then I'm tailing behind him. We go over to the hospital, and dad comes out, and he's in a sling, and he's like, "You're the chief bottle washer, and your sister's gonna do the laundry." And I'm like, "What?" And so, and I'm like, "Well, where's mom?" And he goes, "She's got a triplicate of stuff going on. She's gonna go to the hospital." He goes, "I get the night off." I'm like, oh my God. So I'm like, "Dad, that doesn't work like that." And he goes, "Well, then call the long-term care company, get them out here." And that's when I got a rude awakening. And they were like, "Diane, you've known about this. They have to show that they need care for 90 days. Your dad's not going to need care for 90 days. I mean, they know me, because I used to work with them, with General Electric, GE back in the day. That was Genworth. Now it's Care Scout. I mean, it's just been all these different things. And so they were like, "Oh, no. Does he have a short-term policy?" I'm like, "What's that?"
Me, that's why I'm calling. Right.
So I told dad, I'm like, "Dad, you don't have the right coverage." "What?" "You're my insurance agent." And I'm like, "Oh, Dad, I'm sorry." He's like, "You get, as soon as I'm well, you're gonna get that for me." And I'm like, "Okay." And so that's what we did, because I didn't really understand that 90-day propensity thing. But it's on here, it's on our worksheet. It tells you typically 90 to 100 days plus 90-day propensity need for care. And that's what makes it long-term care. And so it's a long shot. But it's one where, so people think, "Oh, I have in-home care. I have in-home care." No, you have it when you need it for more than 90 days. And that's what they have to know. And they're not happy about this when they find out. But then it's a matter of showing them, okay, how many medications do you take? Let's see if we can get this, shored up, this gap shored up for, a really low cost. And so it's not going to change your lifestyle to have it, but it'll change your lifestyle if you don't have it. And then they're like, "Oh, okay, that makes sense." And then it's a matter of, when you see their long-term care, asking them, "What's the waiting period?"
So I was going to ask you.
Is it
Triggers.
Is it going to be, or do you have the Genworth and the John Hancock plan that say that when you're in home and you have in-home care and you have a plan of care drawn up by a professional, it waives your days and it counts as your days in the home towards the days that you would have to satisfy when you're in skilled care. So there's policies out there that say okay, if you do qualify for the in-home care and you're going to need it for more than 90 days, if you have that in-home care for those 90 days and you have that plan of care, that when you go to a facility like assisted living or a nursing home, you don't have to satisfy those 90 days. But here's the problem. The problem is that everybody gets these little sheets for their long-term care. And it says, "Oh, you can non-forfeiture your long-term care and you can get all your money back." And then when you need care, we'll give you the amount of money that you've put into the plan, which is like 20,000. But if they kept the plan and they were paying their,
Mhm.
$3,000, $5,000 a year, they would have $300,000. Okay, so they don't call their agent, and like me, I'm like, call me and let me go over this with you so you can make a good decision about what you should use. And they think the little sheets that kind of look like this, that come to them from the company, they think they have to choose. They have to choose one of those four. Here's the deal. They are under no obligation to choose anything.
Hmm.
And they say must be chosen by this date. No, 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 no. That is a fabrication.
Yeah.
It does not need to be chosen by that date, because after that date, they can choose anything they want. They can't go up in their benefits, but they can lower it any way they want to. So, for example, if one of those sheets comes to them and it says, oh, it's got to be 4% more, or you can only choose 3% of your compounding inflation, or you can only choose like 2% of your simple inflation, or you can only choose 0 for no more inflation protection. Okay, those are set. And then they tell you the date, and you think, I have to make a decision. No, you don't. Because after that date goes by, you can call them and say, I just want 1%. You can go any piece lower at any level that you want to go after that date.
Interesting. Okay.
Isn't that
Mhm.
amazing?
Yeah.
They're just sending those out to make their job easier. So anything that comes from the company, you got to question it on these old plans and go, what's the motivation here? Because they are thinking, well, we're going to pay out a lot on this person. They've had this a long time. Now they're going to need care. Oh my gosh. So that's an oh my gosh, you've just hit the level where you're going to need this. That's why you're getting that sheet. And that's the important part, to tell everybody that gets those, that has long-term care. Oh my gosh, when you get that page, you tell me, we've got to go over it.
Okay.
And so that we can look at it and see, because some of it is, you could make if you had a 0 elimination period on that long-term care, you could make it a 100-day elimination period. Okay, that's going to bring the price down. And then put in a short-term care.
Yeah.
And say, no matter what, you're not going straight to the nursing home. You're coming home for 90 days, and you're gonna have this, and it's gonna satisfy that wait, because you will have started your clock ticking, because you needed to have the long-term care on this day, but you're going to satisfy it with this plan. And so there's ways to be able to do that with certain plans, and piece them together so they're not completely wide open exposed financially.
And paying a fortune monthly.
Exactly.
For the long-term care plan.
Exactly. Because the way that it works, having a long-term care plan, and this is still the way that it is out there in the world, as it was in 1998, and that is when you have a long-term care plan and you go and you apply to that nursing home, it's guaranteed money for them. It's guaranteed money.
That's true.
Yeah. You can assign the benefits over, and they get paid, and they know how long they're going to get paid and how much they're going to get paid, and they'll tell you, oh, it's not going to move you in any faster, but let me tell you what, I've always seen it to where it does. Imagine that.
I believe it too.
They know I mean, right. It's like this.
Somebody
okay,
going,
Pam,
do you have a Medicaid bed?
You know, I'm gonna
go.
No, I have a policy to bring you money, or I'll just write you a check. Which one are you gonna pick? We're running a business.
Oh, yeah, I'm gonna go with a policy, guaranteed. I get it.
You can't come out and say that,
check.
but that's
Right.
That's guaranteed money.
Yeah.
Of course. So, and then the other thing that's really important too that people don't realize, they think, oh, I can just get my Mid-East area and aging book and my aging ahead book or whatever book from wherever you live, and you can look in the back and you can say, oh, look at that. That's a gorgeous facility. I want to go there for my Medicaid bed. Oh, they have Medicaid. Wow, that facility is awesome. They have a Medicaid bed. Oh, wow. No, 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 no. It's not like that. You go on Medicaid and you are chosen a place to live 100 miles within. That's it. That's it.
Usually
It's
it's
always
two
what
stars.
I've heard. They're always pretty far
Usually
away.
it's 2 stars. Those Medicaid beds in those gorgeous facilities are reserved for those people who have paid them money.
And you'll keep getting denied and denied and denied and denied if you keep trying to pick your own.
Exactly.
I went through it with my mom.
Is
Exactly.
that what happens? Yeah,
Exactly.
they just never get in, and
And
then
they
she
don't-
ends up going
And no
somewhere.
one tells you
in the
that it's
country.
because they had long-term care insurance, they got their money for years, and they guaranteed them in a continuum of care facility. We'll take care of you once we get this amount of money from you. And they list it as a Medicaid bed.
That makes sense.
Yeah, how about that?
Yeah, I
So
mean, I would
it's
be
a-
if I was one of those facilities. You're going to
Yes.
give priority to somebody who just got 400,000 from, when
So
goes
those,
on to Medicaid.
so that
right?
is part of the traditional long-term care that the hybrid annuity and life insurance does not do. Hybrid annuity life insurance is for people that will say, and I love these policies too, and I'm so glad they have it. The only way you can get a lifetime coverage. So if someone has the propensity to have Alzheimer's in their family, I think Kathy just left. So she left.
Oh, she said she had to go
So,
get her friend. Yeah.
So with the hybrid annuity policies, it's one where they've come up with a certain amount of money that you pay, and then you can, if you need long-term care, you can access that money to pay for the long-term care.
I've heard of some of
And so,
those.
yeah.
I've
So
heard of-
for someone that needs to have it for life, then that's a really great thing. And for people that cannot get long-term care traditional, and because of underwriting, then the short-term care is a great way to go, or the hybrid life, the annuity. There are some guaranteed issue annuities. They're guaranteed issue.
I have heard of some, just as long as you live at home.
Yeah, yeah.
Just something else.
Or it could just be for facility, assisted living and a nursing home. And so it's one where it really depends on the person's wants and needs. But I will say this is important. The short-term conversation can be really short. Okay? It's kind of weird.
Just because it's so good.
It's so good, and
Mhm.
it's like, okay, it makes sense. You might as well have it. It's not going to change your life to have it, and you really are going to need it. And
Mhm.
and you can use your medications to offset it. But the long-term conversation is a long conversation.
I
You
see.
really cannot have it with any of these other conversations.
Okay.
It is
Too much otherwise.
It is. It's really on their own. And I will tell you this, that a lot of financial planners will suggest it, and they're looking at it as asset protection. Because they realize the only thing that will make you spend your money beyond your control is long-term care. And that's one of the key questions to always ask your client, towards the end when you're coming up with, suggestions and that type of thing is, what is the only thing that will make you spend your money beyond your control? And you just wait till they give you the answer, because they'll give you all sorts of different answers, and there's no other answer. There's the only thing that would make you do it is long-term care. They've got their home covered, they've got their car covered, they've got their life insurance, they've got all of that covered. So who is in the category for the affordability of long-term care? So back in the day, in the late 1900s, we would say, do you own your house? Do you own your car? And do you have 50,000 in the bank? Just money. So now it's, do you own your house? Do you own your car? And do you have $150,000 in the bank? Okay, that's the long-term care client. Because then they could lose it all. They'll lose it all. And when I say that is my mother-in-law and my father-in-law, my former mother-in-law and father-in-law, this was in 1998 when I went into the insurance industry. And he had a Parkinson's-like syndrome, and she had 3 brain tumors, none of which were part of a Medicare code. So all of their long-term care, which was at the same time, which is way beyond the statistics, was $1 million. In today's dollars, that's 4.3 million. Now, when I tell you how humble they lived, she never worked, had 5 kids, and he was a fire chief. She followed that stock market like nobody's business. And she did everything with that money to send all the kids to school and all the kids to college and everything. And she was a rock star.
Sounds like
He
it.
had every receipt known to her existence in that house, just like an accountant would.
Yeah.
She was amazing. And they lost all of that money that was going to go towards all the
That's awful.
grandkids, school, and so they all went to state schools, so that's great, but they all were going to go to private schools. So that can change somebody's life and
Right.
their life trajectory, and it wasn't what they wanted, and they just didn't know. They didn't even know about long-term care insurance. I didn't know about it when I first heard about it, and I was like, oh my gosh. So I became very, very passionate about it, and that's all I did for 6 years was long-term care insurance. And before I went back into the classroom and then returned 14 years ago. But it was one where long-term, when I would call people, you have to be healthy to get it. Unless now you could do like the annuity products that are guaranteed issue. And the questions were, have you had a stroke? Have you had a heart attack? Have you had cancer? Have you had HIV? Do you have any other autoimmune disorders or diseases? Are you on any, designer drugs? And then it was, that was the health questions. And then it was, do you own a house? Do you own a car? Then it was 50,000 in the bank. And then, it would be 150,000 in the bank. And so that would be the profile for traditional long-term care or the long-term care hybrid. And then I would send them out a sheet and say, okay, these are the health questions, answer these health questions. So I'd make that go faster, when I would meet with them. I still do that to this day. And then I would show up and close everything and just have a conversation. Because the first question that you ask someone is, what were you thinking when you wanted to have this conversation with me?
About saving money in a worst case scenario.
And so for me, it would be up to me to dig and 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 dig until I could understand the picture in your mind of what long-term care looks like for you in that picture. So, for example, I'm going to use me as an example. So if you were asking me and I said, yeah, I want to meet with you. I want to talk about long-term care. Everyone says that and they try and keep it surface. It's not a surface. It's not a surface conversation.
Get into the nitty-gritty.
It is a deep conversation to the point that you would get to the point with me where you would say, Diane, so when did you feel like it could happen to you? When did you see yourself in the picture? Because I would be describing to you, I saw my mom, I saw her in her room. You would say, where was she? What hospital was she in? Who was her doctor? You're asking all these questions about everything. I mean, who, what, where, why, when, how? Who, what, where, why, when, how? You're asking all of these questions about me. Was your dad there? Was your sister there? Was your brother there? No, I was just there with mom, just by myself.
I am selling it to you and I'm asking all
Yes,
these questions.
yes.
Okay.
Who, what, where, why, when, how?
All right.
Who, what, where, why, when, how? And you're getting to the point where you're asking me, you're trying to figure out the moment that I thought, oh my God, this could be this could be me. And then it's, what do you want for yourself? That's when you get to have the conversation. That's when you've earned taking out the piece of paper. Otherwise, you've never earned the conversation to have that with that person about long-term care. That's why financial planners don't sell this. Because they think
It's an emotional.
they think it's
yeah.
transactional.
Yeah,
No,
and
it is not, it is very, very emotional. Very, because with me, you would get to the point that the trust would be there and you would say, okay, so where was your dad? You know, he wasn't there in that room with my mom and I. Where was your sister? She wasn't there. Where's your brother? You know, because you'd ask me, well, where were all of your mom's caregivers? Where were they? You know, and I was at the hospital, and you get to this point asking me, and I would tell you, I was at the hospital sitting by her side, and she was touching her fistula, and it was hurting her, you know, after having the ileostomy, and after, it's going to be hard for me to say this. And then after having all that, and she looked at me and she said, this cancer thing, Danny, this one's going to get me. You gotta watch this. And that's when you ask me, is that when you realize this could happen to you? Ask me that question.
Is that when you realize that could happen to you?
That was the moment. Now you're ready. And then you're ready to say, I'm gonna get out my paper now, and we're gonna come up with a plan. And we're gonna see if you already have a plan for this. So, and then you have permission to ask me, who are your caregivers? Who is going to be sitting
now
there?
The trust is established because we've gone through that and heard your
you've gotten to
your life and what
happened.
The
reason why we're really talking about this, because no one will come to you or agree to talk to you about long-term care insurance unless they've lived it. And so you've got to see the movie that's playing in their head.
All right.
You have to know. It's so important, Pam. I mean, like that's what moves the needle.
I believe it.
Because it's one where you're like, oh my gosh, okay, so tell me, you know, so you would be like, okay, who are your caregivers? And I would say Eddie, and you would say, can he lift you? Can you lift him? You know, no. No.
Yeah.
Okay. And you're like, well, what about your niece? What about neighbors? What about friends? What about because the number one reason why people want to have the long-term care insurance, regardless of if they want it as a hybrid or a traditional or whatever, the number one reason is they do not want to be a burden.
That would be my reasoning.
I do not.
Yeah.
I don't.
Yeah, right.
You know, and so other people say, I want peace of mind. Peace of mind for what? That you don't want to be a burden.
Yeah,
you know,
exactly, right.
I mean, do I really want every single day for Eddie Ellis,
looking forward
to give me a bath like Dad did for Mom? I mean, like, I don't want that for his life. You know, I don't. And so it's getting to that, down to, again, the picture. What are you picturing? What did you experience? You know, you're asking those kinds of questions. What did you see in that relationship between your mom and dad? Do you want that same thing for you and your husband's relationship? You know, these are really deep questions, and you've got to go deep.
Do you get emotional when, like, do you use yourself as an example, saying, I don't want my husband to have to give me, I mean, I would be saying that about my daughter. I don't want to interrupt my daughter to come give me a bath.
It's an absolutely beautiful, beautiful conversation. It's beautiful. Yeah. Because it's so clear the table, let's talk. Yeah. And talk about, you know, and so you kind of have to clear your mind, you have to clear everything else off of your plate, everything that is in because you're just letting this solution come through you, the best part of you, your soul, you know, that you are tapped into anyway. And then you're saying, okay, so you don't want to be a burden, so we don't have caregivers, so we need caregivers. Okay, did your mom have home health care? Were you part of that? Did you provide that?
Mhm.
All those questions. And then it's a practicality thing and saying, well, one way to pay for it is to go on a Medicaid. Is that an option? So we don't have caregivers. Okay, so we
Mhm.
know that. Okay, no caregivers, I would write that down. What about Medicaid? You want to spend all your money down and, and you go to zero and then live
Yeah,
400 miles
I would
around?
say no. What's
Okay.
left, I want to preserve.
Okay. So your whole life, you've always covered your life with insurance, right?
Mhm.
So you can build a little house and you can put little lines around it and say, you've got your house protected, you've got your car protected, you've got your health insurance protected. And then the question is, what's the only thing that's gonna make you spend all your money beyond your control? What's the only thing that could happen?
Health, poor health, and having to pay
Yeah,
for a hospital and nursing home,
the long term.
the long term. Yeah.
So if I could show you a way where it wouldn't change your lifestyle to pay for long-term care, would you be interested in knowing more about that?
I would say yes.
And then what I do is I can show them, hey, here's your nest egg. So what's your rainy day fund, looking like? So you've got, let's say you're typical and you got your house, but if we were really talking, you'd really tell me.
Yeah.
At this point, I mean, we
Right,
love each
yeah,
other.
exactly. I
Just
know how
like-
they share
this
and
is
all.
why I've
and-
had clients
yeah,
for 20
uh-huh.
plus years,
Yeah,
because
they know you're.
we had this conversation,
Mhm.
this heart to heart
Yeah.
conversation, soul to soul conversation.
Mhm.
And so, so then I would say, okay, so you'd say, oh, I have like 500,000, and that's what I have beyond my house and beyond my car. Okay, what are you doing with that 500,000? Are you just making money off of that? Are you making 5%? You're making 10%? Are you living off of that? You find out that information.
Okay. What are
So
they doing with it?
Yeah. And then what you're doing at that point is you're finding out, let's say they said, well, I make 10%, but I put 5% back and then I live on 5%. Okay. So now you have 5%.
Are you writing all that down then? Okay, the numbers.
Yes,
Yeah.
because what I'll do is when I'm writing, when I'm writing it down, here, I'll make a little picture for you.
Okay.
So I've done this picture of the house on one page. Here's your house that you've protected, and you have these blocks on it. So you have your health insurance, and you have your car insurance, and then you have your home insurance. So you use insurance for all of it, but what's the only thing that would make you spend all this money beyond your control? And you're like, here, so everybody can kind of see it in a pretty artwork. So but you said long-term care,
I'd
right?
say some sort of long-term
Yeah,
care. What is that? What most people say?
Yeah, well, that's the only answer.
Yeah. I didn't know how they
Because
phrased it.
because
If they, yeah, if
Because
they
it's
said
beyond,
going
it's
into.
beyond their control.
Yeah.
You can't control it.
Mhm.
But then everybody wants to know, well, what's the statistic? Well, the statistic is 1 in 3 women go into a nursing home. 1 in 3.
Wow.
1 in 2 men, if they live that long, they're in there for 1.8 years, is what one statistic says. Another one says 2.3. So, right in there 2 years for the long-term piece.
Yeah.
We're not just talking about like, let's get healthy at home and stay as healthy as you can at home, that kind of thing. We're talking
The odds are very high. Yeah.
it's the
In
highest.
this room, right?
It's the
One of us
highest.
or two of us
And
would.
it's higher than car insurance. It's like I think it's only like 1 in, I don't know. I think it's like 1 in 1,000 or something like that, get in a car accident. And then no. It's higher than that. What is it? How many people get in a car accident a year? How many people get into a car accident a year?
Her brain's like, you know what? I want to know something too. I messed it up talking.
No, it's like it's basically 40,000. So, and our population is 360 million. so that's
Yeah.
not right.
Yeah.
I mean, that is like so
That's one in
ridiculous.
100,000.
But yet we keep all that car
Yeah.
insurance. That's ridiculous that we do that. I'm dropping it. No.
Don't do that. I just had to use mine.
How many people in a year use homeowners insurance? Oh my gosh, let's see. What is it? for homeowners insurance?
I love it.
Dropping it. Okay. That's hilarious. Okay, so let's see here. One in 1,800.
That sounds more realistic.
One in
Yeah.
1,800. Okay. But if you did 1 out of 3 for men, for women, and 1 out of 2 for men. Oh, good Lord. Now you have to imagine that you're driving through your neighborhood and not 1 in 1,800 has a flame house fire or the whole thing. But you gotta imagine that one, no flames, no flames, flames, no flames, no flames, flames.
Yeah.
Oh my God.
Right. The whole
It's like
neighborhood.
burning
right on
fire.
Yeah. It's on.
It's on fire. It's on fire. So if I could show you a way where it's affordable to have that covered, then you're interested,
Mhm.
right? Okay, so
I really am. You're a great salesperson.
so you're like, yeah.
So whatever. Sign me up. Whatever it
Yeah.
takes.
So okay,
Drop in the card.
so we're gonna do
pay for it.
rainy day. So rainy day money. So let's say, you said, I got $500,000, and then I've got, and then I have my home, so that's up here, and you have your car, but then you have $500,000, and you say, okay, it's making me like 10%, and I say, well, how much you drawing off of that? You say nothing. I'm not drawing anything. I'm just putting it right back in. Okay, but you have no protection on this. The only
Right.
thing that's gonna make you
Yeah.
spend it, you
Market. Go
said,
crazy.
was long-term care.
Mm-hmm.
So here's my little handy dandy picture. So if you're making 10% off your 500,000, then my friend, you've got $50,000 every year that you could put to use. You could be spending up to $50,000 and not change your lifestyle at all, and cover this thing and never have to deal with it again. You could go into an annuity at that point if that was this. But if you said, I am putting 8% back in here and I'm only taking 2%. Okay, well, 2% is $10,000.
It's still a lot of money.
2% is $10,000. So if you've got $10,000, well, amen, sister.
Mm-hmm.
We build a plan around $10,000. And instead of that going in there, you move that 10,000 right over here. And you keep all that 500,000. Now, guess what?
What?
This is the only thing that's going to make you spend your money beyond your control. Now you can spend your money however you want to in your retirement.
Yeah, I like that a lot better.
This is going to make you
Yeah,
feel good.
it does. Just the can protect
Okay.
the grandbabies.
So now we've come up with, as long as we don't exceed 10,000 for or whatever it is,
Whenever
as
the
long as we
number
don't exceed 2,000, as long as we don't exceed 6,000, we need to find a plan that works for that price range. Now we know. And then you've got on your phone, you've got Mutual of Omaha, you've got National General, or not National General, you've got Nationwide, you've got Thrivent, you've got now Care Scout on your phone, and you're going in and you've done this ahead of time and gotten some ideas of that person, because they have 150,000 because he's asked them on the phone. So you could base it off of that and just base your quotes off of that, and then just give them more coverage. This is how you do long-term care insurance.
Okay.
Now, why would you do it on traditional? Traditional is gonna also have a partnership plan in Missouri, and so whatever is in your bucket of money. So now we get to the bucket of money. And I say, okay, Pam, this is this point, this one. Pam, do you want a big old bucket of money? And so, okay, so let's say we create this big old bucket of money, and the bucket's got $300,000 on it. What do you want that $300,000 to do? Or it could be $500,000, but let's say it's 300,000. And now we can design how much we want to have go for home health care, and then assisted living, and then the nursing home, and then also the memory care or any other care that comes up in the future. So that's your continuum of care. Now, if you happen to have a short-term plan already, we put that over there too. And we'll say
Okay.
you have the short term. And then it just goes on the continuum of care and where your money can go and what your money can do. Pretty cool. Easy peasy.
Yeah.
And then we all already know it's affordable for you. So all we have to do then is complete the application, turn it in, get an annual premium. Annual premiums are better than monthly premiums. They actually go through underwriting faster. I don't know why, that's just the way it works.
Okay.
And so you take the annual premium, you send it through. It takes about 6 weeks to go through. They get the doctor's records, that the client knows that they're going to get the doctor's records. You call the doctor right then and there.
Okay.
And let them know the records are going to be coming through. They'll be needed, just to let you know. You need to put it in your phone that you need to check with the doctor's office in like 2 weeks, and then you need to check with underwriting in 2 weeks to see where you are and see if they need any more information from the client. But know that they've already filled out the questions for the health before you've ever even come in.
Wondering that on, you know,
'Cause you
so
said it
I
ahead of
pretty
time.
much already know then that they're gonna get it, is,
Mhm,
you know,
mhm.
at that point.
Or you
Okay.
know which category they need to
What-
be in.
What
you know,
insurance company
yeah.
based on what they
Yeah.
have.
Can
Okay.
they do the short term, yeah, only? Can they do the traditional, or should we be looking at the hybrid
Okay.
for them? So, because some people might say, I just want to give you a lump sum and then know that I've got my policy. Well, that's a hybrid, you know, so whatever works for them. Any questions?
Oh,
Yeah.
so many, but just so much to learn.
I know,
Of
it's
some-
so
of
it's
different.
well, you'll be able to watch
Yeah.
this over and over
That's
and
why I
everything.
need to and
so-
learn all the
yeah,
different
but-
companies and.
But
just
and
what-
you can, and
Yeah.
that's what it's really cool about it. And then you can also start with one company and go through, that particular company, and then you can also research it afterwards and see if there's a company that's better, and you can always switch companies. You know what I mean?
Yeah.
So it's not like you're stuck with one thing. It's just that you're just moving it through. But I will say that if you don't develop the need and you can't see the movie for that person, you do not have permission to continue. You just need to pack up and go.
Yeah,
And
because
just
they're
say,
gonna say, I don't have an extra
I-
1,000
I
or whatever to throw at
because
this.
they don't see it.
Yeah,
It
can
hasn't
see
happened to them yet. But then they'll be the ones that call you in 6 months and you can say, what's happened? Did you see yourself in the movie? And I've had those conversations too.
yeah,
And so, and it's really important that they see it. And when they do, holy cow, they really, really see it.
yeah. I think just me, rolling my ankle and needing care and
Yeah.
doing it myself and not bringing my daughter over, it's really humbled me. And I was like, oh, I gotta make sure that in the future she doesn't have to
Yeah.
come take care of me. So it's
Yes.
something I want to apply and get.
Yeah.
For
So
sure.
so it's really there's a lot more ins and outs than that, but the
Yeah.
main thing is I wanted everybody who's listening to know that there is a certain conversation to have when you are conducting long-term care insurance, and it is worthy of its own appointment. It's worthy of its own conversation, and you have to let your clients know this is not gonna be quick and fast. This is a beautiful conversation we're about to have. It is about your life and your dignity. And then they're just kind of like, what? You know, I just say, I can't wait to have this purposeful conversation with you. That's what I tell everybody whenever I meet with them. I can't wait to have this purposeful conversation with you. Because at the end of our conversation, you will have decided that long-term care and having a plan is right for you, or having one is not. There is no gray area with this conversation. And you can set it up like that.
Mm-hmm. Okay.
After this, you are going to be so relieved because you will have decided, yes, this is right for me, or no, it's not. And either choice is a bold choice. I'm just there as a conduit.
Okay.
I'm just there to lead it. I just need to know what's in your brain, you know.
Mhm.
So and that's what you do. So yeah.
I bet you have great success with it.
Oh my gosh. But it has to be, I have to be in the right space. It can't be on a day where I've got other, you know, Medicare appointments.
Yeah.
And, I've got under 65 appointments. It has to be like, this is all I'm doing today,
Mm-hmm.
is having this conversation, because it's all about that person and what they're seeing in their mind. And if you
Mhm.
don't get that from them, that they feel that this can happen to them, and you don't get to ask that question, oh, is that when you realize that this can happen to you? You don't get to that, you're not ready for anything else.
Okay.
And that's the part that the long-term care insurance, you know, it's the financial planning business doesn't understand.
Now, what if after talking about their family and situation that they start to get fatigued, or, you know, just because their emotions are kind of going up and down, talking about a loved one, would that be something you continue the conversation before you get into all the numbers? Because I can,
No.
do it while it's.
No, just do it
Peaked,
all
yeah.
right there, all
Okay.
right there, because the way the conversation is being guided is, it is emotional and then logical and then a
Mhm.
solution.
Okay.
It is, and it's supposed to go in those
Yeah.
ways. Because you're like, okay, you know, it's like, because they're gonna sit there in it and you're like, okay, I just realized, because they have told you, I need a solution. I got this
Yeah.
problem. I need a solution. You better give them one, because
Right.
what
Yeah.
Kleenex is not a
After all,
solution.
yeah, exactly. Crying with them.
I know. I'm the same way. I've cried, I've laughed, I everything. One time, oh my gosh, this hilarious. This one dog got underneath the table. And so I got to the point where I was like, so this makes sense, right? It makes sense that, you know, you're gonna have a caregiver in this plan. You don't have a caregiver. You said that. You don't want to burden your wife. This is not, this is affordable to you. You realize it's the only thing that's going to make you spend your money beyond your control. And you've always taken care of everything like this with insurance in the past. And then he was like, yes, yes, yes. Okay, so I'm handing that to him to
Yeah.
sign it. All of a sudden, the dog under the table, I didn't know the dog was there. The dog farts.
Oh my
And
gosh.
I'm like, and the man goes, if that was you, I'm not signing anything.
Oh.
And all of a sudden the dog comes out from, so I was like, was it me? You know?
He knew, I'm sure, his dog.
The dog comes out from under the table as if he was smiling, like, ha ha ha.
Way to make light of everything. But
It's like, are you kidding me?
yeah, I believe it.
Oh my gosh, it's crazy. It's just nuts. Another time that I had sent all this stuff ahead of time. I'm like, I'm going to send you all of the health questions, everything, because I was driving all the way down to like Cape Girardeau. Woo! And so I had gone to this ladies' lunch in Perryville, and then I was coming over to Farmington from Cape. So I was like, oh, okay, I know what I'm doing. I don't know what I'm doing. And I was driving this manual transmission. And I go past where the farm was, and they live way up here on this hill. And I go past the farm, and all of a sudden I put it in reverse. Oh my God, Pam. I'm like teetering on like the ravine is here, the ravine is here. And my little Saturn at the time was like teetering and everything. All of a sudden I see two lumberjack looking dudes come out of the farmhouse. I mean, they really did look like Paul Bunyan. And one guy was like, he comes up to the car, he goes, And I'm like, me.
Can you sit on the hood on this side?
Like that. Whatever you do not push this car. So he goes, so manual windows, I roll it down.
Funny.
He goes, I have one question for you. I'm like, what's that? He goes, do you sell insurance better than you drive?
Awesome.
Oh my God.
That is
Oh
great.
my gosh. So I was like, he goes, because you know where you're here. And I'm like, I hope I know I'm here. He goes,
Funny.
he's like, we got to keep the farm. And I'm like, oh my God. So we really
That guy
keep
sounds
the farm.
great. Yeah.
So I told him, you scared me up to death. He goes, well, we gotta hook you up. So he came down the hill with with his big old truck, and he hooked it up,
Funny.
pulled me out of the ravine. Oh my gosh, I'll never forget that as long as I live.
I bet.
So his dad lived
Just so-
another 23 years. And his dad passed away, and I would get like Christmas cards from them occasionally. And so, because they were such a sweet family.
They sound fun.
And
Yeah.
so anyway, he sent me that his dad had passed, and he said, thank you for helping us keep the farm.
Oh, how sweet.
Right?
Yeah, it does.
Like,
yeah,
yeah.
that's one of those you want to put up on the wall.
Yes.
In a frame.
Yes,
Yeah.
where you're just like, oh my gosh. And so, yeah, I can remember there's so many memories like that where you're just like, what? So.
You do kind of become part of the family,
You
just
do.
a little bit of things that I've done with like elder care and sat in, with the attorneys with them, and you're hearing all the stuff. So they think of you as family when you know how much money they have.
Yes, everything. They tell you everything. But you have to know, in order to really help them, you have to know where they're at with everything. And they have to know you're a vault.
Right. They do. Yep.
I tell people all the time, I talk a lot, but I don't talk to a lot of people.
Good.
About
I'll
your
have to
business.
remember that to cover it.
Your business is your business.
Yeah. I'll have to tell the people that. Talking a lot, but I'm a vault.
But I'm a vault with a lot of talking.
It's a really big wheel.
Exactly. Oh my gosh. Okay, so everybody, that kind of covers everything with long-term care insurance, short-term care insurance. If you want that worksheet sent to you, we'll send it to you, and we'll be back in just a little bit. Thank you so much.
Easy.
Let's see how to save it. Here we go.